Last night's passing of the health care reform bill will bring coverage to 32 million uninsured Americans, but the true cost and the effects on the economy obviously yet to be seen. Here now with more on the vote, Congressman Earl Blumenauer, member of the Budget and Ways and Means Committee, and Congressman Darrell, ranking member of the Oversight and Government Reform Committee. Gentlemen, good morning to you both.
Good morning.
Hampton used the phrase "by any means necessary," and the Journal today has an op-ed inside the Pelosi sausage factory. For those who wake up today and are sorely disappointed this is law, do these challenges give them hope, or do you think this is a fait accompli?
Well, first of all, the end justifies the means has new meaning here in Washington, that the rules that used to apply don't apply if you're doing something, quote, for the people. What I think people need to understand is some aspects of this bill may be brought down by the courts, but for the most part, the taxes in this bill, the huge amount of new taxes, taking money out of the investment in private sector and putting it into this will remain. One of the reasons this is deficit and not only neutral, but slightly reducing in the anticipation, you know, the forecast, which never comes to pass, is because there's a huge new tax increase.
So why don't you think those will be why are they not vulnerable to challenges, the taxes?
Because they're not. If you simply say you're going to tax investment...
That's Congress at work.
The Congress at work. So the one thing I understand is the taxes will stay, the benefits will cost more than they should, and our economic engine of prosperity has been hurt by a bad decision. The problem is real. Some of the solutions in this bill were agreed to. Ultimately, the bill is not about bipartisanship unless you count the 34 Democrats who joined with the Republicans who said this is wrong.
We've heard that point made this morning already. Do Democrats need a strategy to protect what's been passed, or is the focus going to be on convincing the American people why it's going to work?
Well, the most effective strategy will just simply let people see what's in the bill, understand it as it unfolds. I find it somewhat ironic that my friend Darrell and the Republicans are somehow decrying procedural actions that they refined. I mean, reconciliation has been used repeatedly by the Republicans to actually increase the size of the deficit. The heated rhetoric that somehow this is a massive takeover of health care is simply false. To take some of the most ardent anti-abortion members of Congress and call them baby killers was just frankly regrettable and I think shameful.
It was more than regrettable. It was denounceable.
The fact is that the legislation here is going to start making a difference this year in terms of eliminating the horrible practice of denying coverage when people get sick, being able to have children insured despite pre-existing conditions, to have tax credits available for small... All of these things start happening, and the superheated rhetoric and the embarrassing behavior will be put aside when people see that after a century, we finally are moving towards reforming Medicare and extending health care to all Americans.
How do Republicans counter that? Because the benefits, whether they're paid for or not, are going to kick in.
They are paid for. I mean, our neutral scorekeeper, CBO, said that they are. And there are buried in this legislation things that, sadly, the Republicans decided not to work with us on. Remember, Boehner said they weren't going to legislate this year. They were going to communicate. Are ways to strengthen the ability to change Medicare practices so it rewards value over volume.
But aren't you worried about the discipline it will take, the political stomach it will take to follow through on the changes to Medicare, to raise taxes on union families? That's discipline you may not have to worry about, current members may not have to worry about.
This is something that we start on now. But in terms of the risks and the discipline, you saw it where people were facing a mob and some, frankly, Republicans playing to it. People put their political careers on the line because they believed in giving health care to the Americans. This is the best chance you're going to get. I mean, the Republicans passed goofy stuff that was going to artificially reduce the benefit, like the cuts to physicians that they never intended to employ and have joined everybody to try and kick down the field. This is a framework that you can actually get some savings.
This is where Earl and I perhaps disagree, regardless of the details of the bill. There's no question that they're gaming the $500 billion cuts to seniors. They're not going to do it. Ultimately, one of the problems is Medicare is leading inflation. It's part of the problem. Speaker Pelosi last night talked about the two great accomplishments before, Social Security and Medicare. Well, our seniors who paid in their whole life understand those are essentially Ponzi schemes who are beginning to run out. They're beginning to cost us so much that people know actuarially they're going to
hugely
bankrupt
popular,
us. Of course,
and do great things for people. But unaffordable.
Free money is always popular. Now, there is something that Earl mentioned that I think is fair for us to talk about. The federal preemption, although maybe not constitutional, was widely agreed to, that we needed to deal with portability, pre-existing conditions, these sort of things where you say to the insurance industry, look, individually, you can't afford to do this, but under an overall mandate, you can spread the cost so that you don't deny coverage to somebody whose child happens to get sick, they lose their job, and then they can't find another insurance company. There were things in this bill that will be popular, that could be done. Oddly enough, the ones that take effect immediately are the ones that cost nothing and, for the most part, could have had broad bipartisan support.
Did you ever have a moment's doubt or worry that although this bill will begin the process, that future Congresses would not follow through?
Well, look, it's always a struggle. I just mentioned the things the Republican did and ran away from. This provides a framework to actually start reducing costs by changing the way that we practice medicine. And I truly think, and I happen to be one of the people who is concerned, as Darrell is, that Medicare right now is what's driving us over the edge fiscally. This provides a framework I think we can actually work on together to change the practice of medicine, not like our friend Paul Ryan, who wants to eliminate Medicare for people under 55, but reward accountable care organizations, move forward in terms of changing eliminating and discouraging unnecessary hospital readmissions. These are things I think, after the bill is established, we will work on together and make stick.
Well, and Earl has been a champion for preventive medicine, for good health, and so on. And I think everyone in government appreciates that. The problem is, if you go to score it, you make the assumption that we're going to not just take pork out of Washington, but out of our diets. And you can't count on that. The American people will not get healthy because we tell them to.
But CBO didn't score that. But I'm quite confident that these are practices in the long run that are going to provide a healthier society, and changing the rewards under Medicare to how physicians practice, so they don't just have procedures and tests and procedures and tests without accountability. These are things that I think we'll be able to work on and make a difference.
Those are the longer of the long-term goals on all of this.
But they're the only way we're going to save Medicare is if we can drive down if I put 10 pieces of metal in your neck instead of 5, I get paid twice as much. We've got to make those changes. Sadly, we didn't make them in this bill. It means we're going to be back to the drawing board trying to figure out ways to keep Medicare from running up the cost of health care.
It's going to be interesting to watch. Appreciate your time on an important day, Congressman Issa Blumenauer. Thank you very much.